All right, Donna, let's do safe start before I go home for the rest of the shift.
Great.
Okay, so here's your feeding bag. It's due to change at like 2 o'clock today.
Okay.
It's going to your G2. Then your maintenance fluids, D5 half around 20 of K, going 2 cc's an hour, and those are going through your white lumen of your MedComp.
Okay.
That's just your heparin bag for your modified manifold.
Okay.
And then going down, so there's the rate of it going at 2 manifold. Then you have your 2 cc heparin carrier for that manifold.
Okay.
And then we have your this is just your med line.
Okay. So we should probably change this to the Kyros cap because it's just having the syringe, the saline hanging from here.
Okay. We're putting Kyros caps on it now?
Yeah, we should put Kyros cap every time our syringes are done.
Mm-hmm.
So since it's done, let's just put Kyros cap on it. And that should be for like anytime we do a central line or a peripheral, we should just change it Kyros cap on.
Because it could be a risk for infection. That makes sense.
Yeah. Okay, so let's take a look what we got. I'm just gonna follow your lines down.
Go ahead.
I think what I'm gonna do is I'm just gonna fix these lines. It looks like you were probably busy last night, and sometimes these lines hanging on these cables hanging on the lines, we'll start pulling on our lines, and then our dressings will start coming off. So, and then it'll give us a good way if we untangle them to find out where everything is going. Make it look nice and neat. And I'm sure you were busy. You didn't get a chance to do it.
Yeah, here I can help get this bottom one too. Get his blood pressure cuff.
Okay. And then I'll be able to trace them a little bit easier. So I usually just put everything underneath so that nothing's hanging on any of these lines.
Awesome.
Okay, perfect. All right, so let's see what we got here. So we've got our maintenance going in our MedComp, and this one's our smaller gauge needle on our line in our MedComp. So even though we have a continuous, we probably should run the heparin. That's our policy. So we need at least 1 ml of heparin going through this. So I can do that during the day when I get on.
Perfect. I actually have some on that bottom pump, or have some on a desk ready to go, because I wasn't sure.
Okay.
So I have that heparin ready for you too. We can get that going too.
Perfect. So yeah, we'll run heparin in there, and then this is perfect. This is our bigger lumen on our MedComp, and this is to draw blood, and this is the one that can get heparin locked.
And that's also where your med line's going to for your intermittent meds.
Perfect. Okay. And then let's see. And then our feeds. The only thing that we see too, Shannon, with our feeds is we probably don't want. It looks like this has been dripping over here.
Yeah.
So it looks like it might get into our lines. We probably should just.
Is that some formula in this one?
Yeah,
Or-
I think we need to. It's best to kind of keep these two separate.
Okay.
And if they have to go across each other, put something in between so that the feeds actually are not getting into the lines. Okay.
Awesome.
All right. Sounds good. I think everything else. And
And
let's go
then-
ahead and take a look at the dressing.
I'll let you go first. You got my phone?
Let's go ahead and look at your ID on. Okay. So your dressing, you got the MedComp. It looks like it's a little boggy. We'll probably have to change it. And it looks like somebody left the stat lock on it. Do you know when they change this? I don't see a date or a time.
It was changed yesterday by day shift. They must not have timed and dated it.
Okay. Well, we'll need to change it anyways because the stat lock shouldn't be showing.
Okay.
Everything underneath the dressing should be sterile.
Okay.
In the big line. It's hard to keep these stat lock, these Sorba views on a stat lock with a pick line because it doesn't cover these stat locks, so it's best to use a regular.
Perfect. Okay. We'll go get some stuff and I'll help you change all these lines and get
Okay.
everything else situated so we have a good start for your
Great.
day.
Perfect.
Thank you. All right, Donna. I'm gonna change that dirty microclave while you get the table set up for our dressing change.
Okay, perfect. I'm gonna clean this table for 2 minutes and then make sure it dries before we use it.
Oh, and I also added that heparin 1 cc flush to this 23 gauge for us, so
Oh.
we have heparin running through our continuous.
Perfect.
infusion.
I'd hate for that thing to clot.
Right? Alright, so I have the patient mask, I have my mask, I have my alcohol swabs, and my flush and my site scrubs to change this dirty microclave.
Okay.
I'm going to do my hand hygiene.
You said you have alcohol?
I do have alcohol.
What do you use alcohol for?
I am using alcohol to change the dirty microclave instead of CHG because the CHG makes the line sticky.
Oh, so you just use the alcohol to clean on the outside?
I do. I use it while it's still connected. I'll take the alcohol and clean around and try to get in the crevices of this microclave.
Okay.
And then I'll disconnect and give you the line, and we'll put a pigtail on it.
Okay.
And I'll use the actual site scrub to clean without the dirty on and attach the new clean microclave.
Oh, okay, that's perfect. So why do you put it inside there?
We are afraid, we don't want to, when you put it inside there, you want to absorb up all that formula and all that dirt so you don't disconnect, clean with a site scrub, and then put a new microclave and just attach the same dirt to go in the line.
Oh, that makes sense.
All right.
Hey, I noticed your patient's got some nice tattoos here.
I know. Do you think Mom consented for that?
Probably.
Let me just put my gloves on.
Okay.
All right, I'm going to clamp my line.
Hey, you want to use this first?
I do.
There you go.
Thank you. All right, I'm cleaning all around. And then take the corners and I'm going to go into the around, trying to get all that formula out.
That makes a lot of sense.
Right, doesn't it?
And this is the same thing as with the CHG. It's important to let it dry, the alcohol, right?
Yes.
So it kills everything?
Perfect. Okay,
Okay.
I think we got it all out.
Okay.
I'm going to disconnect. I'll hand you my lines.
Perfect.
I'm going to take my site scrub.
How long do you usually scrub for? I always forget.
It is 10 seconds scrub. So I'll watch the clock for 10 seconds.
So I was taught to do 10 turns. That's not right?
No more 10 turns. We're doing 10 seconds with a 5-second dry time.
Okay.
All right, we are dry. And then we can attach our new microclave. And then we'll disconnect here. And we'll do side scrub again at 10 and 5, 10 seconds, not
Okay.
10 turns. I'll give it a 5-second dry time. And then we will attach again.
Perfect.
And we'll unclamp.
Okay.
Perfect.
So
All right,
let's
let's
set up for the...
dressing change.
Yeah, do that real quick.
All
I'm going to
right.
just put my hair back and take off my watch.
Perfect. I'm gonna get stuff to take off the dressing
Okay.
as well. Alright, we're gonna take the dressing off and we're gonna change this dressing because it's not dated or timed. The the vial patch is a little boggy and my stat lock was out.
Yeah, those stat locks are big. It's hard to get them in the regular sorbent use. I'm gonna use this
I'm gonna
as my
take the
garnish.
tails off.
You know what I'm gonna do is let's put this underneath. It'll give it a nice clean surface
Perfect.
so that sometimes our linens or things underneath are a little dirty. These pick lines are always hard to do. There's nothing easy about them.
Alright, now I'm going to take my big dressing off and I'm going to go towards the insertion site.
Oh, why do you go towards the insertion site?
You don't want to pull away because what if you pull your line out?
Oh, that makes sense.
Right?
So since that stat lock,
It's all you.
well, since it's already been contaminated, what I'll do is I'll take it off and I'll change my gloves and then use another set of sterile gloves because since it wasn't underneath the dressing, then it's not sterile anymore.
Perfect.
So I'll do one with a CHG,
Okay.
clean it, take off the stat lock,
Okay.
and then do another, change my gloves, and do another CHG.
Okay. These gloves are sticky, aren't
They are sticky.
they?
I tried to get all my
We
stuff
got the
together.
good ones, didn't we?
And I try to undo everything to make it a little bit easier when I actually have to put it all together.
Do you need a bio patch or anything?
I do have a bio batch.
Perfect.
And then I just noticed these wings, they kind of stick together. I gotta just make sure that they're ready to be put on. Okay. So, let me see if we can. And then I'll scrub for 30 seconds. So if you can watch the clock for me.
All right, it's been 30 seconds.
Okay. Throw that off. So let me take off the stat lock.
Perfect.
Okay. And I'm going to hand you this Q-tip, if you can just do that.
Okay.
And I'm going to change my gloves. Oh. Okay, so we put the stat lock on. We just got to put the dressing on. If you could just pull the arm out just a little bit. Okay, make sure we don't get that. You can lift up those lines. And we just want to make sure we cross it. When we lay down the dressing, just make sure you kind of push down on all the edges. Otherwise, it'll start coming up. Okay, and then we're going to use this piece and lift up the legs, or the line. And make sure that that little area that's open is sealed. You can put those down and put one more steri strip over the top. I try to just give it a pinch right there and lay it. And that's it. Now we're just gonna put a date on it. And my initials. That's it.
Perfect. Thank you so much. It looks great.